Dr. B, can you help me? Dr. B, can you help me?
In this week's edition of Dr. B, Can You Help Me? It's another continuation of some of these overuse injuries that we oftentimes see. This one is setting expectation. If you do decide that you want to see me as your physical therapist to deal with, say, an Achilles tendinopathy, like that, tendon in your lower leg that's bothering you when you run, when you walk, when you play tennis, when you golf, I have to help you understand the process that we have to go through in order for you to get to where you are now, to where your goal is. Every one of my patients cares about pain relief. If they have pain, most human beings don't want to deal with pain, and certainly certain levels of pain that keep you from doing said activity are definitely not acceptable. So in some of these circumstances, I have to set an expectation of like, hey, John, we're going to start seeing some pain relief fairly early into this process. 4 weeks, probably 6 weeks, okay, dealing with the Achilles. The rehab is going to create some discomfort, but the end game is that we end up getting some reduction of your pain and we get resiliency, we get strength of the Achilles so that it doesn't come back and you don't hurt yourself worse. The warning of when pain starts to subside, that does not mean that it's fair game for you to stop the exercises and to just go about your normal life. Pain reduction doesn't mean that there still isn't an impairment that needs to be addressed. In totality, a lot of these overuse type injuries, the research is very clear that it takes anywhere from 12 to 16 weeks to actually start seeing changes in the tendon itself. Pain reduction may come earlier, but if you want a strong Achilles tendon and you don't want to end up like Aaron Rodgers with a torn Achilles, you have to give it a set amount of time because it's a muscle. This is all based on physiology. It's not based on our own hopes and desires. The human body has a lot of things that are fairly consistent. Physiology and anatomy are one that stay fairly consistent. There are ways you can speed it up a little bit, but even with the best of tools, we still have to have a realistic expectation of you're in it for anywhere from 12 to 16 weeks of consistency, progression of what I give you to work on to really see the end goal clearly so that you don't have to come back into my office for the same issue. If you're dealing with an overuse type issue, don't wait. Let me help guide you. It's easy. It's not complicated. It's, you could watch YouTube videos till you're blue in the face, but you're not going to know what to do, how to progress it. Just let a professional guide you and get you back to that activity and pain reduction as quick as possible.